Hey, listen, I didn't prepare anybody for this, so I don't have any idea how close a close-up you can get without scaring the children. But I will tell you right now that the end of my nose wasn't even there a while back because of a basal cell skin cancer. And the end of my nose left, not because of the cancer, but because of something called a Mohs procedure. Don't worry, if your doctor says to you, I think that probably I would consider a Mohs procedure, doesn't mean you're going to lose the end of your nose. Look at this award-winning nose, huh? Yeah? Huh? Dr. Davey, the Mohs procedure is your specialty, for crying out loud. 15,000, 25,000 skin surgeries as a dermatological surgeon. I'm glad you're here in the Valley. But in my case, I had never heard of the Mohs procedure before my dermatologist suggested that I need it. Why do you think that that kind of a decision is made?
Oh, the reason that we do Mohs surgery is because it's a very simple but elegant type of procedure. And it allows us to have the highest cure rate, but at the same time leave as much of you behind as we possibly can. And from your personal experience, you can see that that makes a big difference in terms of healing.
Is it always decided on the basis of whether it's basal cell or any other kind of skin cancer?
Well, we actually have something called appropriate use criteria now, so it helps us make an informed, educated decision about when we should use Mohs surgery and when we shouldn't use Mohs surgery. We primarily work on the face, and we work on basal cells, squamous cells, and malignant melanomas are the main tumors that we take care of.
If one has basal cell, does it mean that automatically, if it's untreated, it moves into those even more serious categories?
No, actually, basal cell does most of its damage by local destruction. So it can grow onto nerves, it can destroy the end of your nose, or it can do something along those lines. It doesn't mean that you're necessarily going to get a squamous cell or a malignant melanoma. You can kind of think of it almost as a marker that you might have trouble with squamous cell and melanomas over the course of time.
Hey, will you please pay attention out there, for crying out loud? Not only is this a highly qualified doctor, but you know what? You are highly qualified for skin cancer. You don't want to know why? Because you live in Arizona. That's why. And when you're talking about this kind of sun exposure, it's one of the reasons why it is that we featured the Mohs procedure in skin cancer on an upcoming medical show that we do here at 11 o'clock on Saturdays, Health to Fit, exclusively on AZTV, and Dr. W. Patrick Davey is part of it. Why is it called Mohs, by the way, M-O-H-S?
It's actually named after Frederick Mohs, who is a general surgeon in Wisconsin, and he developed the technique. And then it changed about 1970 to the type of procedure that you had, where we actually do frozen sections. So what we're going to do is we take a piece of tissue off that goes all the way around and all the way underneath the tumor. Then we're going to flatten that out and check it under the microscope. So we actually make sections where we check it under the microscope. And it's all done in the office setting. We have a lab that's set up and we can do everything there.
My experience was that when the slice was done, tiny, how thin?
Well, we do as thin as we possibly can, but we have to get a margin around the tumor and leave as much of you behind as we possibly can.
But how thin is the slice itself?
Oh, it's just a few millimeters thick.
All right, so then you go into the waiting room and you wait to find out what they have found, what you have found, under the microscope. And there may be then yet another procedure. You go back into the surgical room.
Right. So while you're resting, what we're doing is that we're making a map so we know whether the cancer is going north, south, east, or west.
Oh.
And then we go back just to that specific area and take a smaller piece off and check that under the microscope again.
And sometime, as in the case of a god with an enormous sense of humor, saying, oh, TV guy, well, we'll take a few more slices off the end of your nose.
Right.
I had corrective surgery after that, plastic surgery done here. Is that common?
It's very common that we'll do reconstructive surgery after doing Mohs surgery.
And would that be true also if it was on my shoulder or my back?
Well, we actually would, those we can do a simpler form of reconstruction surgery. Basically, there are 4 different ways you can get a wound back together again. You can let it heal on its own, which we tend to do more on the body than we would on the face.
Yes.
You can do a graft, which is moving skin from somewhere else onto the nose, for example. You can do a flap, which is moving adjacent skin in, or you can actually just pull the edges together.
So, as people are listening, I mean, I don't think I have to tell you, because you're the surgeon who has to give people the news across your desk. And they're saying, oh, well, wait a minute, hold it. Grafts and flaps, for crying out loud. I may decide not to do this. Is it a decision that's a good idea?
Well, it's never a good idea not to have your cancer taken care of. So you need to find some method that you can have it taken care of.
Is there an alternative to Mohs?
There are a number of other methods that people use. The problem is that we take care of all the recurrences. So when somebody has another method used and it doesn't work, then they come to us to have it taken care of.
If I ask you the most vulnerable citizen that we have here, or group of citizens, may I assume that I am among them as a light-skinned Irish guy, right?
You are. My Irish cousins are the ones that have the most problem with it.
So prevention?
Prevention's key. We always preach that people use a sunscreen, and in the valley of the sun, you want to be at least at a 30 SPF for your sunscreen. If you can use the shade, you want to do that. You want to be underneath the shade as much as you possibly can to cover yourself. You want to be careful about reapplying sunscreen. So if you're on the water, for example, you want to be really careful about putting sunscreen back on after you go swimming or go boating or whatever you're doing.
And if you want to find out more, of course, there's always Health to Fit Saturdays at 11 o'clock in the morning. And if you want to call me, of course, I will be regularly available to you to talk about my nose procedure. Oh, it's Mohs, excuse me. This is Pat, back in a moment.